Did you know that back pain is the leading cause of missed work days globally? In fact, it is estimated that up to 80% of people will experience back pain at some point in their lives. So what is the cause of all this back pain? Let's break down the most common reasons why your back might be hurting. Number 1. Muscle strain and sprain. One of the most common reasons for back pain is muscle strain or sprain. This often happens when you lift something heavy, make a sudden movement, or even after a long day of physical activity without proper stretching. The muscles or ligaments in your back can stretch or tear, leading to pain, stiffness, and sometimes muscle spasms. Number 2. Poor posture. Another major factor is poor posture. Spending hours hunched over a computer, staring down at your phone, or even sitting with a rounded back can put excess pressure on your spine. Over time, this can lead to chronic back pain that just won't go away. Number 3. Herniated disc. Next on the list is herniated disc. Discs are like cushions between your spinal bones, but sometimes these discs can slip out of place or rupture. When this happens, it can press on nearby nerves, causing sharp, radiating pain that extends to your arms or legs. Number 4. Degenerative disc disease and arthritis. As we age, our bodies go through wear and tear, and the spine is no exception. Degenerative disc disease and arthritis can cause the discs in your spine to break down and the joints to become inflamed. This can lead to stiffness, limited movement, and constant discomfort in your back. Cause 5. Sciatica. If you are experiencing pain that radiates from your low back down to your leg, you might be dealing with sciatica. Sciatica happens when the sciatic nerve, which runs from your lower back to your legs, gets compressed, often due to herniated disc or bone spur. Number 6. Structural problems. Structural problems like scoliosis, kyphosis, or other spinal irregularities can also be culprits. These conditions cause the spine to curve abnormally, putting extra stress on certain areas and leading to pain. So when to see a doctor? While some back pain can be managed easily at home with rest, ice, and over-the-counter medications, there are times when you should see a doctor. If your pain is severe, lasts more than a few weeks, or is accompanied by symptoms like numbness, weakness in your legs, or trouble controlling your bowel or bladder, it's time to get professional help. So these are some of the most common causes of back pain. It is important to listen to your body and take steps towards finding relief. Don't forget to like, subscribe, and hit the bell icon so you never miss an update. Drop a comment below if you have any questions or want us to cover more health topics. Thanks for watching and take care of your back.